Thank you, Acting Speaker. I rise to speak to the State Taxation and Mental Health Acts Amendment Bill 2021. And I'm proud to contribute to this debate where we once again highlight the need for action on mental health in Victoria. We've just seen the budget handed down last week by the Treasurer that well and truly shows the measure of our values. And this government has shown its commitment by establishing the Royal Commission into mental health. And we've shown our commitment in promising to implement all the recommendations of that Royal Commission outcome. We've received the report and now we're putting into action desperately needed resources. And this is a government of action. This is what getting things done looks like. I'd like to thank the Treasurer for the budget that prioritises mental health in Victoria. I'd like to thank the Acting Premier, the Minister for Mental Health and the previous Minister for Mental Health for their hard work and dedication that they, on behalf of this government, have done and continue to do in this area. The previous Minister for Mental Health, the now Health Minister, came out to my electorate in Melton for a mental health forum. The forum was well attended by parents, carers, sufferers, health workers, community groups, teachers and advocates. It was clear, talking to those in that room, that when it came to mental health in Victoria, more needed to be done to address the crisis of mental health. The people there wanted to know that their government had their back. They wanted to know that they were being taken seriously and that this government takes this issue very seriously. We have a budget that does exactly that, Acting Speaker. The handing down of the Royal Commission report was handing down a challenge to this Parliament and to this government. The Mental Health Royal Commission found that for too long, the mental health system had been inadequately funded and recommended that the only way to protect mental health funding into the future was to have a dedicated funding source. And this government promised to implement every single one of the Mental Health Royal Commission's recommendations, and that's exactly what we are doing. The Andrews Labor government are asking that the largest 5% of employers to increase their contribution to funding government services, so that all Victorians, including businesses, can benefit from the mental health system reform. The Mental Health and Wellbeing Levy will be implemented as a payroll tax surcharge on wages paid in Victoria by businesses with national payrolls of over $10 million a year. A rate of 0.5% will apply for businesses with national payrolls above that $10 million. And businesses with national payrolls above $100 million will pay an additional 0.5%. This levy will raise approximately $900 million each year by 24-25. And the Royal Commission found that the cost of poor mental health to the economy is about $14.2 billion each and every year. The cost of inaction is far higher than the levy we are introducing to rebuild the mental health system. That cost for business is not insignificant. Inaction on mental health costs business in lost productivity, health and safety, staff culture, staff retention and turnover. For a business in Greater Melbourne, this means wages between $700,000 and $10 million retain the current 4.85% payroll rate. Wages between $10 million and $1 to up to $100 million are taxed at 5.35%, and of course above $100 million at 5.85%. Regional employers pay a lower basic payroll tax rate of 1.2125%, a quarter of the metropolitan rate. For very large regional employers, the levy will apply on top of this lower rate, meaning all regional employers will still have the lowest payroll tax in the nation. The Mental Health and Wellbeing Levy will begin on 1st of January 2022. And existing payroll tax exemptions for private schools, hospitals, charities, local councils and wages paid for parental and volunteer leave will apply for that levy. For more than 95% of employers, Victoria continues to have one of the lowest payroll tax rates in the nation. For regional employers, they continue to have by far the lowest payroll tax rate in the nation. And we are asking the largest 5% of employers to increase their contribution to funding government services so that all Victorians can benefit from the mental health system reforms. The Royal Commission found that a 15% reduction in the level of need experienced by Victorians diagnosed with mental health illness would deliver $1.1 billion in additional economic activity in the Victorian economy every year. Total payroll tax revenue as a share of the Victorian economy will continue to remain lower than when this side of the House came to government. So how will Victoria benefit from these reforms and this budget? Well, I'll just read out a few of the projects and programs that will benefit from this budget. 22 new adult and older adult area mental health wellbeing services to help people with more complex needs. $954 million funding for that. Facilitating government and community-wide suicide prevention and response, $173.3 million. And this will support the statewide expansion of the HOPE program, including ongoing funding for 9 additional adult HOPE sites, 4 new child and youth HOPE sites, and sub-regional follow-up care. It will establish a suicide prevention and response office, and it will develop an intensive 14-day support program for adults who are experiencing psychological distress. This program is well needed, and my own staff, like many others here, take calls from people in distress. The HOPE program has gone some way to help some of these people who reach out, but the service has been stretched to the limit. I'm happy that this program isn't just being funded, but it is being expanded. Integrated care for people living with mental illness and substance use or addiction, $42.4 million. And this establishes new addiction medicine specialist hubs to support people living with complex needs, and will establish new statewide services for people living with mental illness and substance use or addiction. Mental health reform in education, setting up children and young people to thrive, $217.8 million. And I'm excited about this investment to establish the Schools Mental Health Fund and pilot. The mental health needs of our young are far more complex and different from the challenges that many of us faced. The use of technology, social media, and the pressure of schooling and an economic climate vastly different from when I was a younger person means that our young Victorians face very different challenges that can affect their mental health. When I was younger, we just didn't talk about mental health. Our schools need to address and help our younger generations thrive with new skills and understanding. Continuing the mental health in primary schools pilot and expanding it from 26 schools to 100 schools is a fantastic outcome. And I was so pleased to see that this government is continuing its good work on the Victoria Carers strategy in many of these reforms, especially when it comes to younger carers. Young carers do an amazing job against the odds and often without the support of others that they receive. This care often comes to the detriment of their own physical and emotional well-being and causes increased strain on their academic and social lives. And strengthening identification and referral pathways for young carers is a well-needed inclusion. There's also new local mental health services for adults and older adults in their communities, $263.8 million. Mental health-led emergency responses for Victorians in crisis, $7.5 million. And that fund commences design and planning work to transition from police to paramedic-led responses for Victorians experiencing mental health crises. And I should say that paramedics are much better placed to deal with these issues rather than the police responding to them. New models of care for bed-based services, $370 million. The other great outcome here is supporting Aboriginal and social and emotional wellbeing, $116.1 million for statewide expansion of social and emotional wellbeing teams to Aboriginal community-controlled health organisations. Creation of Akuri mental health liaison officers in infant, child and youth area mental health wellbeing services, and the provision of capacity building of VARCO, including funding for co-design of 2 healing centres and a training centre. Supporting families and carers at $92.6 million. Once again, this government delivers on its carer strategy, because mental health doesn't just impact individuals, but the families that surround them and their carers. Delivering 8 family and carer-led centres across the state, and funding non-government organisations to co-design and expand the range of supports across Victoria. These amendments and the budget just handed down show where this government places its values. The Andrews Labor government doesn't just say what we want to do, we action it and we also fund it. The values are clear and they are precise, and I commend this bill to the House.